Hello there, and welcome to another episode of our Facebook series. I'm Dr. Samantha Durland. I'm board certified in obstetrics and gynecology, as well as anti-aging and regenerative medicine. I'm also fellowship trained in metabolic and nutritional medicine. It's a mouthful. But today what we are going to talk about is breast health. The month of October is Breast Cancer Awareness Month, and when you think about breast health, it brings up a lot of thoughts and emotions. And I think for a lot of women, breast health is very important, and I think also the concept of breast cancer and breast pathology elicits a lot of fear for individuals, because we can see that 1 in 7 women over their lifetime will get breast cancer, and that is a statistic that you can see yourself in. And when you see yourself in a statistic such like that, it can elicit fear. Well, there's been so much development regarding breast cancer and breast cancer treatments, and people do usually quite well with this. So that being said, what is breast health, and what things could we do in a simple way to help us be more confident? So number one, of course, there are mammograms, and there are different types of mammograms that are performed now, including the 3D. Mammograms very frequently are covered 100% under the Affordable Care Act because they are screening. So it's nice that there's not really a cost for a lot of people associated with it. So other than taking the time out to do the screening, there really aren't a lot of barriers, hopefully, to actually obtaining the imaging. You also want to be the most aware about your breasts as yourself, and doing self-breast exams. A really nice place to do that is even in the shower, because it's wet, you can kind of move around. And so you always want to do your breast exam usually about the same time in your cycle if you're still cycling. For the first half of your cycle, your breasts usually aren't so lumpy and bumpy, but in the last 2 weeks of the cycle, a lot of times that happens. So if you're inconsistent when you're doing your exam, then sometimes you can be misled to think that there's a difference when it really just has to do with hormonal change, because your breasts are totally full of all these little cells that are hormonally responsive. The other thing to know about breast health that I think is important to know is that a lot of times we may, if we ever have the opportunity to breastfeed, we could have like a mastitis while we're breastfeeding. So what the heck is mastitis? Mastitis is where one of the ducts gets clogged and kind of backflowed, and it gets infected. So we actually get an infection in the breast that causes redness and a fever. Well, there could be a little scarring associated with that. So if you've ever had a breast injury, or meaning you got kicked in it or something, or you have mastitis for the rest of your life, a lot of times, especially when you're perimenopausal or around the time of your period, you may have one breast that feels a little bit more tender in a certain area, or a little bit more lumpy bumpy in a certain area, simply because of its history. So I think it's important to know that, so that we don't get nervous that there's more breast pathology there than really is. And so no month to month while we're cycling is that our breast exam changes, and each month our hormones change, and so sometimes you can have a little bit more robust of a breast response, and other months might not be near that much. So just know it can change. Your breasts are dynamic just like you are, and to do your self-breast exams is I think it's the most important thing, because you know your body the most. And if you feel a mass that's new, it should go away after your cycle is completed. And if it's not, or if it persists, then you definitely want to reach out to your doctor and be seen for an exam and get the necessary imaging that needs to be performed. Now, there is a difference between a screening mammogram and a diagnostic mammogram. A screening mammogram is just, hey, I don't have any issues. A diagnostic mammogram is, hey, I felt something. So once you start seeing people for a suspected breast mass, then we start the diagnostic testing, which is slightly different. Another word I want to say is about BRCA test, or BRCA gene mutation. So the BRCA gene is present in about genetic mutations are responsible for about 10 to 12% of all breast cancers. The majority of them are actually sporadic. So some people carry the BRCA gene within their family, and things that would kind of increase the risk of this are kind of red flags that might cause someone to do the testing, would include, bilateral breast cancer, multiple family members who have been afflicted, male breast cancer. Certain descents also have increased risk of BRCA gene mutation. So don't be afraid to have that discussion with your physician. And certainly over time, of my career, the cost of BRCA testing has really gone down, so it's not so cost prohibitive, and there's a lot of protective mechanisms in place, because I also had several patients who would be fearful that they would be like red flagged with their insurance company or something like that, and I've just not really seen that to be the case anymore. So I just want to give people that reassurance. And if I was going to eat differently to try to increase my breast health, what are a couple of ideas I would do? Well, typically you'll hear stuff about like caffeine, some various vitamins, that you want to reduce caffeine intake to reduce breast cysts. Another thing, just as a different thing you might not hear, is that DIM supplement that kind of does help pull out more inflammatory estrogens of your body, and you can find DIM in broccoli and Brussels sprouts. So by simply increasing your intake of green leafy vegetables, you may also enhance breast health. So I think that is all I would like to say about breast health in the month of October. And don't be fearful, get your screening, and if you ever have any questions, reach out and ask for the answer. So I hope you have a great day, and thank you for joining us for another episode.